up until recently, CAR T has only been done at academic medical centers. They were at academic medical centers in places that had bone marrow transplant, because doing cell therapy is somewhat similar. Some of the potential side effects and toxicities of CAR T are seen in bone marrow transplant patients, and so it became natural for transplant centers to become the first centers of excellence. So that's really probably the biggest hurdle, because the manufacturers were only used to dealing with academic medical centers. And when community practices such as mine started doing them in research trials and became familiar with it and felt comfortable and confident that we could do it ourselves, we went to the manufacturers, and at the time their centers of excellence were only at academic medical centers. It took us a while to convince them we could do this. You know, I think I'm proud of my staff, probably more than anything else. My staff and our organization. We all came together. It takes a village to put a program like this together. It can't be just one person. You know, I may have been the one who came up with the idea, and we had the expertise to do it, but I'm very proud of our practice and our organization as well. Our organization provided a lot of backup with us putting together a lot of the contracting, the payer relationships. So I'm proud of how everyone came together to put up one of the first all-outpatient CAR T centers in the United States, certainly the first one in our area. For a long time, being ION's chief medical officer, I saw how community practices related to their patients, and of course I lived that experience myself as a community oncologist. It is really very uncomfortable for patients to have to travel long distances to go to ivory towers where the care may be less personal and less comforting and less familiar to patients. And so patients want to be treated by their community oncologists. They don't want to go to sterile sites and sites that are at a far distance. And so being able to offer a program such as this in the local community provides access that people didn't have before.